Thank you for joining today's Here's to Your Health podcast. I'm Don Lintzman, your host. My guests on the podcast today are Connie Riesselman. Connie is a SHIIP coordinator here at CCMH, and Dustin Durbin, who is our volunteer services and community services coordinator. And we welcome you both to the podcast today. And Connie, thank you very much for being here.
No problem. I'm glad to be here.
Dustin is a sometime guest from time to time, but you're a treat, so thank you for coming and joining us today.
You're welcome.
We're going to talk about Welcome to Medicare. So why don't we start there, Connie? Just tell us about Welcome to Medicare, date, time, place.
I am presenting a free Welcome to Medicare seminar. It is going to be here at CCMH in Meeting Room B on Thursday, March 14th, starting at 5:30, and expect it to last till probably about 7 o'clock p.m.
You said the right word. It's free, so anyone can sign up for this. But we're in particular looking for an audience that is going to be signing up for Medicare.
Exactly. People who are going to be turning 65 in the next few months, because I'll be having another Welcome to Medicare seminar this summer. But in the next few months, if you're going to be turning 65 or know someone who is, or your parents are that you help, or anyone who might be interested in knowing what Medicare is about. Maybe you've been on Medicare for 10 years and you don't even know what ABC Medicare is. This Medicare seminar is for you.
And I think the point you make when you talk about ABC, the supplements that go along with Medicare A, Part A, and Part B, and the C, and the D, and the G, and all those other things, that's a bit complicated. And in the interest of full disclosure, I sat through the Welcome to Medicare seminar last fall, and my wife just got done signing up for Medicare, which was an interesting exercise. It is a little bit more complicated than people actually give it credit for.
Yep. You would think, just off the top of your head, I need to sign up for Medicare. So I need to go to medicare.gov to sign up, right? Wrong. It's through Social Security. You sign up for Medicare through the Social Security Administration.
And there's not much about Medicare or Social Security for that matter. Once you get the government involved, it seems like all common sense kind of goes out the window.
Exactly.
Yeah. My guests on the podcast today are Connie Riesselman. Connie is the Senior Health Insurance and Information Program Counselor here at CCMH, and Dustin Durbin, who is the Volunteer Services and Community Outreach Coordinator here at CCMH. Dustin, when we talk about SHIIP, and we talk about the services that SHIIP offers, let's just discuss for a moment the opportunities that we have to try to help people understand what Medicare and all those supplements are all about.
So, to get started with kind of like the volunteering side of that and the program that we offer. So right now we have Connie, who's with us today, and then her partner in crime on the other side, if you will, is Barb Rooser. And so what they do, and Barb is new this year to Medicare and getting everybody signed up. So she actually is a counselor. As of right now, we're not needing anyone at the moment, but if anyone's interested of kind of helping Connie and Barb kind of get like their packets ready for new Medicare patients coming forward, that's what they can kind of help. So a little back office work, if you will.
Yeah, we're always looking for more volunteers, and they can get a hold of you. They can email you at ddurbin@ccmhia.com, or they can give you a call at
712-265-2520.
Very good. Connie, we talked a little bit about the Welcome to Medicare seminar that's coming up. What aspects of Medicare specifically will you be discussing?
I'm going to talk about Medicare Parts A and B benefits. Along with that comes copays and deductibles. I'm going to talk about that. Prescription drug benefits, which is Part D. We're going to talk about Medicare supplement insurance that covers those copay and deductibles. We'll also go off the tracks, away from the original Medicare, and talk about everybody's seeing all the Medicare Advantage plan commercials, and that is Part C. So we are going to talk about Medicare Advantage plans also.
You, as a counselor, a SHIIP counselor here at CCMH, you talk to how many people who are on Medicare? How many people do you talk to in a given year about their Medicare or their Advantage or the supplemental plans?
I'm thinking between Barb and I, this last year, we saw maybe 220 some people. I think that's about right. Over 200.
Yeah, and part of your responsibility, or part of the goals that you've set forward for yourself, are to help people to understand what all of this is. But in particular, we concentrate a lot on Medicare Part D here because the drug supplement is prescription drug supplement is one that a lot of people have, and that there are a lot of questions about that.
Well, the thing is, people come in every year between October and December to take a look at the new drug plans because the drug plans change every year. So we're here helping people who've been on Medicare for years and years look at new plans every year for that Part D to make sure they're on the right plan for the upcoming year. But other than that, we are available throughout the year for anyone who needs any help with anything. I've had people come in with a pile of junk mail that says something about Medicare, and they go, will you go through this for me because I don't know what's right and what's wrong.
And by the way, I am one of those guys who will be turning 65 this summer, and I'm one of those junk mail recipients. So at some point, I'm sure I will get together with you and we will go through all of that together because I think that that's an important thing.
One important thing about that junk mail is Medicare. If you get letters from Medicare, you would think it would say Medicare on the return address, but it's CMS, Centers for Medicare Services. They don't say Medicare, it says CMS. So that's something people should be alerted to, that they need to be careful.
Yeah, again, we're talking about government work here, and that is a little bit of a different story. My guest on the podcast today are Connie Riesselman. Connie is our SHIIP counselor, our Senior Health Insurance and Information Program counselor, and Dustin Durbin, who is our Volunteer Services and Community Outreach Coordinator here at CCMH. We talked earlier, Connie, about this being a free seminar, but maybe the big thing, if somebody's interested in free things, how do people sign up for this?
Well, that's really easy. All you have to do is call 712-265-2509, and the person who answers the phone there, just tell them you want to sign up for the free Medicare seminar, and they will put your name down and you're signed up.
And what's the deadline for people to sign up for that?
You know, I think I put down that the deadline was going to be March 10th. But you know what? I'm not going to turn anybody away. If they call on the day of the morning of the seminar, they're going to be able to get in. And
Dustin, it's probably what's important about signing up in advance is making certain we have enough cookies available.
Yes, we have to have snacks. I mean, so with it starting at 5:30, don't come hungry, eat before, but there will be some dessert cookies along with, and when I say dessert cookies, they're usually the monster cookie M&Ms, so come for those. And then we'll have refreshments, so we'll have some water and tea and coffee. So
yeah, when I was here for this last fall, I felt it was, first of all, very informative. And it really did help my wife as she made her way through that process. It really did help her to understand what she had to do in order to be able to sign up for Medicare. And she got her card in the mail the other day, so that must mean that she's at least fully insured, at least as far as that goes. She's still working. She still has her health insurance, but she's gotten that taken care of. And so I'm next on the docket, and I've learned a little bit from her. But there's always a significant amount of fear and trepidation. So even after people sign up for the seminar, Connie, and even if they attend it, you're still just a phone call away if they should have some questions later on as they're trying to make their way through that process.
Absolutely. In fact, that's one of the things. If they come to the Welcome to Medicare seminar, normally they do follow up with an appointment with me personally to help them finish up or take care of the last minute details. But it's kind of nice to have a seminar with a group of people instead of people coming in one or two this week, one or two next week, one or two the next week, and I'm saying the same things over and over to these people. It's much nicer to have a seminar and hit 15 people than to be telling one or two people every week the same thing over and over. So I really appreciate it if you would sign up for the Welcome to Medicare seminar, and then we can have a private meeting.
And I think one thing that you said earlier is really important. You know, they're plans that change every year. And even if you're, even if you're not the one who's on Medicare, maybe it's a parent, or maybe you're the caregiver for someone else who is on Medicare, it is to your advantage to come to this meeting to really refresh what you know about Medicare and really understand what those options are for you or for the loved one that you're caring for going forward, because in many instances we can help people save money.
Absolutely. Yep, for sure.
I mean, we don't write the insurance ourselves.
No.
We just show people the difference in the
Exactly.
policies. Here are the things that you can do. But I think
Exactly.
we're all about saving money.
I can help people sign up for a Medicare Advantage plan or a drug plan, but I cannot sign them up for a supplement plan. But I can show them the different supplement plans and what it might cost and how they might go about getting that.
And I think that's really important. Most people just need a resource. I tell people, you know, as I have gone through in my life, the one thing that I know is that I need a guy. I just have to be able to call a guy or a gal to get what I need, because there's no way that I could possibly know everything there is to know about any of these kinds of things. So if I have somebody that I can call, ask the question, get the information, then I know what I need to do in order to be able to solve whatever problem or issue I'm experiencing.
And just talking about that, I don't know everything either, but I have a wonderful resource in Des Moines, Iowa at the SHIIP office, which is located in the building in the office of the insurance commissioner. And they're the experts, and I have them on speed dial. And I usually, if I'm with a client and need to call the Des Moines office, I put it on speakerphone so they can hear from the professional who knows for sure what the answer is to their questions.
So not only do I have a guy, you've got a guy.
I've got lots of guys.
Which is what everybody needs. One more time on the date and time for the Welcome to Medicare seminar and the deadline for signing up.
Okay. The free seminar is Thursday, March 14th, starting at 5:30, planned to end around 7. And I did want to say, as we go through the seminar, I know it can be overwhelming because there's so much information. This is a very relaxed seminar. I have people ask questions as we go. You don't hold your questions till the end and then you forget them. We answer them right away and get that out there so you completely understand it and you're not lost in the dark.
And you'll get a packet of information as well.
Packet of information.
Yeah. So the deadline for signing up is?
It's actually the 11th.
And
again, I will take anyone who calls in.
Right. And the number they're going to call is?
The number they're going to call is here at the hospital, and it's 712-265-2509.
Thank you both. Appreciate your time today. My guests on the podcast have been Connie Riesselman. Connie is our Senior Health Insurance and Information Program Counselor here at CCMH. And Dustin Durbin, who is our Volunteer Services Coordinator and Community Outreach Coordinator here at the hospital. I'm Don Lintzman, your host for the Here's to Your Health podcast. Thanks for listening.